Did you know that approximately 14 million people have a diagnosis of borderline personality disorder? Yet, it's one of the most stigmatized mental illnesses we see today. Hi, everybody. My name is Christy. I am the executive director of Mindspring Mental Health Alliance, and we are a nonprofit organization that provides mental health education, advocacy, and support. We believe strongly in empowering people through our education, giving them the tools and resources they need to take care of their mental health in a way that's right for them and care for those around them. So, we wanted to start the series to just provide a little bit more information on some mental illnesses or diagnoses, and allow people to take the steps that they want or learn more if that's the right fit for them. So today we are going to start with the diagnosis of borderline personality disorder. It is a mental health diagnosis, also sometimes referred to as BPD. And BPD is an illness marked by a pattern of varying moods, self-image, and behaviors. Some symptoms you might see if you either have BPD yourself or are experience or know somebody who is experiencing BPD are just really frantic, impulsive moods, back and forth, hot and cold, frantically trying to avoid feelings of abandonment, chronic feelings of emptiness, recurrent suicidal behaviors or ideations, very impulsive behaviors, recklessness, risk-taking behaviors, that kind of stuff, and just a very big influx in moods, kind of unexplained influx in moods. That's not a comprehensive list of symptoms. There are other symptoms. These are just a few that you might see, and that they use to kind of identify a diagnosis. Causes, we do have a lot of people want to know what causes this, and like a lot of mental health conditions, we don't know the specific cause or why people get borderline personality disorder, but there is research that indicates there are some known components such as environmental triggers such as abuse or neglect. Genetics can play an impact in it as well, and some brain imbalances can also influence BPD, according to the research. So we wanted to just kind of talk about some facts and clear up some misconceptions on this diagnosis. The first being a lot of people believe that only women can struggle with BPD, which is not true. Men can also have borderline personality disorder. It is more prevalent in women, though. We do see it more in women, so that's probably where that misconception stemmed from. Another thing is that there are people who believe there's no treatment for BPD. There is. It is said to be difficult to treat BPD, but many people do find effective treatment, the most common one being psychotherapy. And another thing we'd like to point out about borderline personality disorder is that a lot of media portrayal or people kind of negatively portray this condition as people who are manipulative or controlling, when in reality, this is a very impulsive disorder. So a lot of people affected by this disorder do not have the ability to kind of put thoughts to their actions ahead of time. They react very impulsively. They don't respond well to certain situations or changes in their environment, and so they're going to react. So a lot of times they really don't have the ability to be manipulative or controlling because they are just reacting to their emotions. And we believe this is important to understand and know, especially as someone who might be around somebody with BPD, is to understand that they are not by nature trying to be manipulative or controlling. They are just reacting impulsively, which doesn't always make things easier, but it does help provide some empathy and understanding. And as that individual seeks treatment and gets help, it's good to help them kind of see that and understand where they really are coming from. If you are a person who knows somebody with BPD, we also like to give you a few tools to help yourself communicate with them, and protect your own peace as well. So it's important when communicating with somebody who has borderline personality disorder to really use your active listening as best you can. Make sure you're giving them your attention. You're not distracted by other things like your phone or the TV, that you're really giving them attention and listening to what they're saying. And with that, make sure that you're paying attention to the moods that are maybe influencing influencing what they're saying and not always the words. The words might come out really mean and offensive, but really kind of understanding what's the mood that's driving those words and where is that information coming from is an important piece to support them. And then also making sure that you are caring for yourself. It can be difficult being around somebody with BPD when you feel like you're walking on eggshells all the time, that you can't say or do anything right, that you are constantly getting yelled at or exploded upon. So just make sure that you feel comfortable setting your own boundaries and expressing your own boundaries as well, because you're not going to be able to help them succeed if you are not in a good place yourself. So that is just a little bit of information we wanted to share on borderline personality disorder. Most importantly, I wanted to invite anyone who's interested in learning more to our free community webinars. These are fantastic resources we offer. They are free. Anyone can join. We do require registration. You can join live, or if you register and can't make it, everybody who registers will get a link to the recording the following day, as well as a bunch of resources, recommended reading, and additional learning. These webinars are taught by licensed mental health clinicians. They are an hour in length, and there's an opportunity to ask questions. So we try our best to answer the questions that come through and understand that there's a whole community of people wanting to better learn about this illness and how they can support people around them. So it's a really great way to educate yourself, break stigma, and provide more understanding. If you have any questions or want to learn more, feel free to go to our website. It's www.mindspringhealth.org. You can also comment below. We'll monitor the comments. And if you happen to catch this recording after the webinar has ended, know that we do repeat all of our webinars. So we will be hosting this webinar again, and we would be happy to get you to that information when we have it. So feel free to reach out to us for more information on borderline personality disorder or mental health in general. We would love to help connect you with the resources that are right for you. Take care, friends.